Now on Indianapolis This Week.
We've been preparing for moments like this for a very, very long time.
Taking steps to avoid a possible outbreak of Ebola in Indiana, and why some Indiana lawmakers want a travel ban put in place. And the drug destroying so many Hoosier families and devastating communities. We start our Call 6 investigators' look into heroin in the heartland.
From RTD6, the Indy Channel, this is Indianapolis This Week with Rafael Sanchez.
Thank you for joining us for Indianapolis This Week. We want to start this morning by talking about facts, not fear, about the Ebola virus here in the United States. Just 1 week ago, Mayor Ballard laid out the city's plan if the virus should arrive in central Indiana, and urged everyone to continue on with normal life. And we met with Carmel firefighters about how they're getting ready just in case. The key phrase, prepared if we need it. So what should you know about the response plan and the potential dangers of Ebola? I took those questions to the head of the Marion County Health Department in our morning discussion. Are we as a community prepared for Ebola?
Yes, we are. We're very well prepared. We are a fortunate city that we've got good leadership at the top. We've had several coalitions where we meet on a frequently basis with our other hospital colleagues, our community health centers, our urgent care facilities, our healthcare professionals, with our medical societies. And so we've been preparing for moments like this for a very, very long time.
And what does preparedness look like? Does that mean that we have those specialized suits on standby? Does that mean we have medicines on standby? What does that mean when we say that we are prepared? Right. What does that look like?
So what it looks like is that, yes, we have our personal protection equipment that's available at each of our major hospitals. And yes, we have treatment. But it's because we have a good relationship with the Indiana State Department of Health, who in turn has a great relationship with the Centers for Disease Control. And so if we had an Ebola patient, we would probably get an experimental drug for that patient in order to be treated, besides the standard supportive care with like fluids, electrolytes. You know, patient may require oxygen, a respirator, and some of those other items when they become very, very sick.
There's never a good time to deal with Ebola, but here we are entering the winter season when we're dealing with the flu. And some of the symptoms for the flu mirror the symptoms for Ebola. How will you manage that and not creating a scare or a panic, because the symptoms are kind of sort of alike?
Right, so they are very familiar. So it's so critical that we have to do a really good job of encouraging and motivating everybody to get their flu shot. So if you get that flu shot, you shouldn't have to worry about developing flu-like illnesses or symptoms related to the flu that might confuse you in regard to Ebola. And it's just not even the flu. We have such diseases as malaria, can be very similar to Ebola, but we take a very good travel history. That's the key. Based on your travel history would tell us whether you may be at high risk for having Ebola.
We are by the sort of the official health department sink, because I'm going to imagine that this year you're going to tell folks to wash their hands a lot.
I think you have to wash your hands frequently. And listen, when you're coughing and sneezing, I don't want you to cough in your hands and contaminate your hands. I want you to cough in your sleeve.
See, I'm going to give you the microphone. I'm going to do it as the doctor orders. So you do this.
Right.
Okay, you take the mic.
Okay.
Mic, and I'm going to follow doctor's orders. Follow the mic. Wash your hands a lot.
Right.
We're prepared.
Right, we're prepared. And also, listen, if you see someone who's coughing and sneezing, if you can, try to not to invade that space. You know, give yourself a little distance from that individual. And I also need to tell you that if you're in the workforce area, you know, it doesn't hurt for you to wipe down your computer keys frequently, your telephone. You know, you can self-contaminate yourself. So, you know, use some disinfectant and keep your environmental surfaces clean as well.
Words of advice, words of wisdom from Dr. Kane. Dr. Kane, thank you so much. I have clean hands, by the way. So.
I appreciate it. I washed mine just before the interview. Thank you
so much, ma'am. And thank you for joining us on the program. We appreciate it. A reminder that the State Department of Health has opened a call center to answer your questions about Ebola, from screenings to diagnosis. That number to call, 877-826-0011. Hours of operation Monday through Friday from 8:15 in the morning to 4:45 in the afternoon. Let's continue talking about Ebola. Let's bring in Congressman Luke Messer, a Republican who represents the Indiana 6th District in Congress. Congressman, thank you for joining us on the program. So we have a Hoosier who's been appointed the Ebola czar, and we have now some new travel restrictions. Will that at all help stop the manifestation of this virus?
Well, I hope it does. I mean, I think when it comes to Ebola, an ounce of prevention is worth a pound of cure. After a rocky start, I'm glad to see the administration appoint someone to be in charge of their efforts. They happen to be a Hoosier, as you mentioned. It's important to have enhanced screening, so they've talked about having enhanced screening for folks that have traveled from that region of West Africa to be monitored for 21 days. I do believe we need to have more airports where we have that screening as well. You know, we don't want to be an alarmist, and obviously we are hopeful that this can stay contained, but the best way to make sure it stays contained is to have an all-hands-on-deck approach and take the precautions we need to make sure it doesn't spread.
Does the administration need to go further on this matter? You've been very critical of this. Do we need a travel ban, or is the current system enough?
I think we should have a travel ban, at least temporarily, until we've demonstrated as a country that we're able to handle this. Initial reports from Dallas have obviously been positive over the course of the next few weeks after, again, a rocky start. I do believe that making sure we have enhanced monitoring of the folks who are from that area is important as well.
Will you fund it?
Yeah, we're going to have to fund it. This will cost money, and when it comes to protecting our Americans from Ebola, cost should be no limitation.
Congressman Messer, thank you so much.
Thanks.
Come back on the program. Thank you, sir.
Absolutely.
Coming up on Indianapolis This Week, back on the road, the political insiders on the governor's new travel plan. Welcome back to Indianapolis This Week and the Roundtable. Kip 2 Democrat Abdul Hakim Shabazz, IndyPolitics.org, and Mary Beth Snyder, former reporter with the Indianapolis Star. Welcome to the Roundtable, everybody.
Glad to be here.
And of course, the big issue, Mary Beth, would be
Governor Mike Pence. And I don't know if it's a sign that the elections in Indiana are just boring this time, but Mike Pence is on the road again, and he's in New Hampshire, Massachusetts, Kansas, Arkansas. What does it tell you about the governor?
Well, I think what it tells us is clearly he doesn't have his eyes on Indiana, and he must have just thought that being the governor of Indiana was something he had to check off on his resume to say he was an executive on his quest for the presidency. I mean, I don't know how else you read it any other way.
I fear a challenge coming up.
Well, let's see, a $2 billion surplus, unemployment at the lowest levels. Yeah, the governor really needs to be here to caretake it. And once again, as part of the Republican Governors Association, he makes the rounds. Indiana's a story.
Are you tired of saying that?
No, not really. I mean, Indiana's a story that the rest of the nation wants to hear. And apparently, the governor's a very popular draw. They wouldn't be asking him to come and speak.
But he's collecting IOUs along the way for 2016.
I would not. You can't throw that. You can never say never. And no smart politician would ever want to, totally rule out that option.
Look, running for the president of the United States is a big endeavor. You don't do as he says, well, you can't rule it out as an option. You have to actively do it, and he is clearly actively doing it. He's doing the types of things to put himself in the place to run. He's not like, well, maybe if it happens. The unfortunate thing is, it's not true what he's talking about, that Indiana's in great shape. The $2 billion surplus is largely a mirage, and we're talking about the school funding formula. We heard Speaker Bosma say this week that they're going to go into the school formula and take it away from urban schools and give it to suburban.
No, what he said was they're going to raise the foundation level of money. They're going to raise the foundation level, so all schools
going to
get
wait
more
on
money.
He's waiting on the funding formula.
And then also they're going to adjust the funding formula to help better suburban and rural school districts.
Wait.
Go ahead, I'm sorry.
While the governor has been maybe focusing on other states, he also this week did something important to Indiana and did not take a second chance to get federal funds for pre-K. Is that also about 2016, or is that simply about that this is the best choice for Indiana?
I don't think there's anybody outside of the governor's office, and maybe him because he's going to have to give the talking points, who believes that it's anything other than that. I mean, the fact of the matter is about every major industry in this state, the Speaker of the House, the President Pro Tem of the Senate were not brought in on this discussion, on this decision. All of them were taken by surprise. Everybody thought that that thing was going forward. They had done the application process, and then all of a sudden,
he's appealing to the base.
He's appealing to people in New Hampshire and Iowa. I don't think he's even appealing to people here in Indiana.
Well, first of all, if you actually go and read the grant, there are some things in there that do complicate things for the state of Indiana. For example, one provision in that grant is that the kids that go enrolled in this program must be involved in a full-day program. Guess what? Indiana does not have sort of the daycare infrastructure to do that. Number two, the funding was only for 1 year. I mean, this wasn't continuing funding, so what are you going to do?
Why spend the money?
That's the thing. Wait a second. Why expand pre-K for 20,000 students when there's no guarantee you're going to have the funds
why spend
next
the money?
year?
I mean, a lot of state workers spend a lot of time on a lot of paper. If you going in, you would have known the ground rules. Why even spend time on this application if, in fact, it was not going to be to the benefit of the citizenry?
You see, and I'll freely admit that if I was the governor's office and I found that out early, it's like, nah, guys, we're not going to apply for it because there are too many strings attached and it may not necessarily jive with the program that we have. But for my Democratic friends here to say, let's go apply for a grant and get $80 million, and it wasn't $80 million, probably more like $5 million that they would have gotten in the first year.
I don't know. The TV screen says $80 million grant.
Well, I actually read the grant proposal. Call me crazy. You know, it's amazing.
There was a last-minute attempt by a lot of groups asking the governor to please reconsider. Will this come back to haunt him in a gubernatorial campaign or a presidential or vice presidential campaign if, in fact, we didn't get the money?
Well, I mean, he's not worried about a gubernatorial campaign. He is trying to appeal to a base of voter in Iowa and New Hampshire, who, in the Republican primary and a presidential campaign, is appealing to a very conservative element, and that's what he's looking for.
30 seconds, you have it.
There'll be more money in the governor's budget in the next session for early childhood, for pre-K education, and easily they're going to add another $10 million in, and it never hurts to find out what programs work and what do well before you go in and throw in more money. It's called being fiscally responsible. My good friend being a Democrat
I always feel good at the round table. After the round table, I can go to church. So I want to thank you. I'm going to go to church now.
I go too, but the holy water.
Can I get an amen? Okay.
The conversation between our insiders continues. You can follow them on Twitter. Also, their Twitter handles are available throughout the week. Make sure you stay up to date with Abdul, Kip, Lara, and Jennifer throughout the week. They have so much to say on a Sunday. Next on the program, the crisis of breaking up families, damaging neighborhoods, costing you a lot of money. Welcome back to Indianapolis This Week. The reemergence of heroin is taking a toll on towns and cities throughout our state. The city of Indianapolis has taken an aggressive approach not only on enforcement, but also on saving lives. As this program goes on the air, first responders have saved more than 800 people who've overdosed on opiates. We're now joined by Troy Riggs. He's the Public Safety Director for Indianapolis and Marion County, a job that he's held for 2 years now. Mr. Director, welcome to the program. Are we at a crisis stage when it comes to heroin?
We are not at this time, but we're trying to avert a crisis.
When you look at the numbers, you've given Narcan to more than 800 people. That means you've saved the lives of 800 people. That is staggering.
That is, especially when you look at last year when we had 630 saves for the entire year, and we still have a couple months to go. So we're seeing that, but we were prepared for that. The other thing that people need to know is we expanded it to the Southwest District for policing. We changed our rules and policies, procedures, worked with the State House to allow officers to do that. They have been able to sell or save approximately 40 individuals that had overdosed on heroin. As we're seeing the confiscation of heroin increase dramatically, as we're seeing the use of Narcan increase dramatically, we are not seeing an increase in deaths, and that's a benefit for us right now. It shows that what we're doing is helping save lives. All of last year we lost somewhere around 115 people with heroin in their system. So far this year we're right at 100, so we're not seeing that dramatic increase that we're seeing in the other areas.
The difficulty about enforcing this drug is that you just can't go to one neighborhood or one section of the city and say, there it is. This thing is everywhere.
It is everywhere, and it's a central Indiana problem. And when we sat down and had a community conversation to talk about heroin, and we did on the north side of Indianapolis, about 60% of the people that arrived to attend this community conversation lived outside of Indianapolis. They lived in our surrounding areas. And we learned a great deal from them. We learned that heroin is one of the toughest drugs to get off of. We learned the struggles that families have, and one in particular is that private insurance will not cover a heroin addiction. And so people are are breaking their banks, basically, to try to pay for their child to get off heroin. It's very troublesome when you look in the face of parents and see the troubles that they're faced because a young person has switched to heroin.
And I know that for you at the department, one of the big concerns is the petty crimes that this heroin can sort of trigger as people try to feed that habit. Most of the users, first of all, they steal from their parents, friends, and then they have to go somewhere else to get money. What are your concerns on that?
What we typically see is they start stealing from friends and family at first, but then as their disease and their need for heroin increases, they go to some type of petty crime. But let's not forget, we had 4 SWAT officers shot earlier this year raiding a house that was selling heroin. So it's also leading to violent type crimes as well.
So what do you see as you look forward? Because I know you're very aggressive on looking ahead. What is that plan as you move ahead to deal with the situation?
Well, unfortunately, we're seeing the influx of heroin in our city continue. We're going to look in 2015 at expanding our ability for police officers to administer Narcan. It's in 1 district now. We have 6. Chief is working up a plan to expand that to the other districts in 2015. It'll be expanded some additional firefighters as well in 2015. And then we're asking the EMS to lead the way to see, is it time to equip citizens that have someone in their family that has a heroin issue, to equip them with a prescription to go out and get Narcan, to have it on standby in case their loved one does overdose. That's a discussion we need to have with the medical community and also with the State House.
Somewhat controversial in the sense that you've always said saving a life is important no matter who it is.
It is. We have to value life. And in public safety, we say each and every day our mission is to value every life in the city of Indianapolis, whether it's a murder victim, a murder suspect, someone that died of heroin. And people ask why. Well, we think that's the right thing to do. And when you talk to some of the victims, the families, and you see the pain and hurt, you'll never have to ask that question again.
Director Riggs, thank you so much.
Thanks for having me. I appreciate it.
You're always welcome to come to the program. We thank you for your time. Our coverage of heroin in the Heartland begins tonight at 11. Through the week, the Call 16 will look at the impact on families through heroin, the cost of recovery, the source of the supply, and why it's so tough to enforce. Our stories again will air on RTV6 on the news at 7 and 11 throughout the week. When we come back, running in Indianapolis, but not for elected office. We're talking about the Monumental Marathon as Indianapolis This Week continues.
Good morning, I'm Jade Hindman. Here's what we're working on right now at RTV6. New overnight, Indianapolis firefighters say a northeast side home is destroyed after a large fire. The fire broke out just before 4:30 a.m. in the 2700 block of East Adams Street. Firefighters say people in nearby homes were evacuated. Authorities tell us no one was hurt. The cause is still under investigation. And a man is in the Hamilton County Jail this morning after he ran a car into a Noblesville police SUV. Officers say they believe alcohol was a factor. Police tell RTV6 Francisco Velez swerved but ended up hitting the parked SUV on 141st Street. There were no officers inside. 2 passengers in the car Velez was driving, however, were hospitalized. Remember, you can stay up to date on all the latest breaking news on the RTV6 app and the IndyChannel.com. Have a great day, everyone.
Run, Indy, run. RTV6 is getting ready to cover the city's Monumental Marathon. Runner's World called it the top 10 best new marathon in the United States. In 2013, it was billed the 26th largest race in the country. Now, earlier this week, I met with Blake Bolden for our Sunday Spotlight.
Blake Bolden, we are getting ready for the Monumental Marathon, which is now 6 days away on Saturday.
Yeah, it feels like it could be tomorrow. But yeah, we have a few more days to make those final preparations, get registrations, and then we kick the expo off Thursday afternoon at 4 p.m. Goes 4 to 7 on Thursday, right at the Convention Center, Expo Hall D, and then on Friday from 11 a.m. to 9 p.m. And even that night, we've got expo speakers all day, and then we're partnering with IMPD and a number of downtown venues for a trick-or-treat trail. So it should be a fun event and a whole weekend full of activities.
15,000 runners are expected. What makes this marathon different than the others, the New York, the Boston, and all those around the country?
Yeah, absolutely. Well, especially when you compare to those top 2 or 3 that you mentioned, we're the new kids on the block. We're just 6 years old, headed to our 7th, and we're unique in the sense that we really capture what is Indianapolis, downtown Indianapolis, the Museum of Art, the State Fairgrounds, and we're also non-for-profit that supports local public schools. So in 6 years, we've donated over $500,000. In the last 2 years, we've created our own youth running initiative, and this year we're within 29 IPS schools throughout the city, getting kids active for 9 weeks, and it all culminates on Saturday, where we give them free entry to our 5K, and we're expecting over 1,000 students.
And so what's the plan, though? Do you plan on one day being that premier? Is that the plan, to one day being like a Boston or New York? Or do we even want to be like those big races on the East Coast?
No, I think that's what's beautiful about Indianapolis. We don't need to be New York. We don't need to be Boston. We don't need to be LA or even Chicago. We're just happy being Indianapolis. And I do think as we
echo that, because we are a great city, so we don't have to copy. But we would like to reach that stature, right? We want those big runners to one day all come here and say, look what we have, right? We got it all, too.
That's right. And I think we're on our way. Considering Boston Marathon's over 100 years old and New York's the largest city in the country, and all what they have, what we've done in our first 6 years, we're on our way. And one big part of that is Indianapolis is a city that and a community that really surrounds itself and supports itself with huge events. Obviously, every May, there's a lot that goes on. We've hosted a Super Bowl, we've hosted Final Fours, and that's something that our city does very well. So we're very fortunate to be here and be a part of it all.
Now, I hear from Kevin Gregory, the master chief meteorologist at RTV6, that you're going to have great weather. So great weather is going to make for a great event.
I'll hold Kevin to that. If anything else, I've got his number. I'll give him a call if it goes otherwise.
I have his extension. He's telling me that you're going to have a great event, but you're going to have a great event anyway because of the energy and the excitement that this event brings to the city.
That's right. An example, in 2012, we had hail, we had snow, we had some nasty conditions, but I'll tell you what, the volunteers were never better. The crowd support was never better, the neighborhoods, and it really bonded people that day. So we're really, whether the weather, rain or shine, we're going to be out there raising money to support kids and bringing people from all over the country and world to Indianapolis.
RTV6, a proud sponsor of the Monumental Marathon. It's this coming Saturday, November the 1st. Registration begins at 6:30, opening ceremonies at 7:30, and that marathon kicks off at 8. We'll have full coverage for you on Good Morning Indiana Saturday with Jade and Kyle. Thank you for watching Indianapolis This Week. Next week, we'll talk about the election and the final days of the campaign. I'm Rafael Sanchez, and we'll see you next Sunday.